Let's jump right in. Um, our webinar today is going to be about smart scheduling and how we can use AI to fill our chairs, boost our profits, and save time. So thank you for joining. I am Sheila Roth. I am head of clinical education at Pearl, and I am going to focus today on filling empty chairs and how to streamline that. We all deal with these cancellations and no-shows, patients leaving without their next appointment, and we're going to walk through that. Love to have some interaction from your side as well. So feel free to, again, get familiar with that chat. We're going to also explore a few reasons and some ways to navigate through why patients cancel and why they're delaying treatment. I'm going to share a few tips about some communication, some scripting, some handoffs to the front, and also kind of how we can use AI as a virtual assistant to do some of those tasks that allow us to step away from redundant things like, let's see, reaching out to patients, verifying insurance, that kind of stuff. And we will also, of course, talk about how AI can boost your case acceptance and your case presentations. So sit back, relax. Let's jump in. Okay, I'm going to share my screen here, and we are going to dive into smart scheduling. Okay, so first we want to talk about cancellations. And we all know that we have looked into these hours that are openings. And if you're an office manager or a coordinator, you're looking at, oh, I need to fill Dr. Smith's schedule. And if you're a doctor, you're always wondering, are we going to fill that schedule today? So we're going to go through those scenarios. We're going to talk about enhancing case acceptance. And again, how we're going to use AI to help make sure that this empty chair is not going to exist in your practice. Now, I'd love to hear from you guys if you are familiar with the average cancellation rate. Does anybody know that? Feel free to put that in the chat, and I'd love to hear from you. So I thought it was about, 10%, hopefully. Um, Anybody else want to chime in? I see 20% here. I see 25%. Excellent. So let's look. The average 22%. Love it. The average cancellation rate is 12 to 15%. Now, I'm sure all of us would say, well, depends on the time of year, depends on the day of week, right? And in reality, it's still a problem we cannot solve. So let's take a closer look at the no-show rate. Same question. Love to hear from you. You're going to get comfortable working with the chat, I hope, because we're going to make this interactive. It's really great to have real live feedback from you guys because we're all in this together, right? So 5% for no show. Anybody else? I feel like I'm at an auction. Anybody want to go 6%? Anybody 7, 7, 8, 8%? I'm just kidding. I have to make it fun, guys, because I'm sitting here by myself. So it's about 15 to 30%. So historically, we're still looking at these rates, haven't changed a whole lot except during certain times of the year. But this is a battle we are all facing on a daily basis. I used to say back in the day when I started dentistry, if I could find a way to solve the cancellation rate, I could retire. But humans are our consumers, right? We don't have the luxury of doing anything when a patient has a cancellation for a, emergency. So we have to be mindful of that, right? How are we working with our patients? How are we making sure they're not canceling? And we're going to jump into that. I do want to kind of sit here for just a moment and let you know that we at Pearl did a study, and this was a wonderful and surprising statistic to me. So 75% of practice managers said that making their schedules full and focusing on production is their top challenge, right? So that was great because I remember when I was managing a practice, it was really one of our biggest struggles was we have a lot of patients, but our schedule was never as productive as we really wanted. And how we were able to move through that was challenging even before AI. So we have a lot of solutions today. I do want to say that this is the number one way to focus on scheduling. And this seems like a very simple picture, but in reality, 35% of incoming patient calls to dental practices are missed. That's a very high amount of percentage. So when you look at your customer acquisition cost, that's a problem. But even in general, I was talking with somebody yesterday and she said, yeah, it's really hard for me to understand, like, do I finish up what I need to do now to get this in the chart? Or do I wait to check out my patient? Or do I answer the phone? And I said, well, you have to do them all. And so, but this is becoming an unfortunate reality right now because we see less staff in the front, in the back, in the world. That's a different webinar. But we do need to be mindful of solutions for stopgap. So one idea is to at least make sure that you have a way to reach back out to missed calls. Well, number one, let's make sure we answer the phone. But number two, if there is a chat bot of some sort that is on the website, you can have a live person monitoring that. In fact, it could go to the front desk and multiple people could be monitoring that. And that's a really important way to be mindful of those missed calls. There's great companies out there also that were able to, when there's a missed call, right? The patient automatically gets a quick text saying, we are so sorry we missed you. We'll give you a call back in 24 hours. But if you need to reach us right away, feel free to text us. In this world, we are really focusing on, immediate gratification. We need something, we need it now, right? I could probably order coffee, which I need right now, and it would be here before the end of this webinar. And we are a dental practice, right? So we need to be mindful that missed calls are a luxury for us to be making sure we follow back up, right? Patients don't want to call the dentist, right? So this was another thing we need to kind of step back and think about. How can we, while we're sleeping, be able to accommodate filling our schedule? Now, I'm leaning straight into online scheduling because I want to let you know, in my experience, we used to use a company where we would just have one column for new patients for hygiene and one column for new patients for doctors. And we had one column for any emergency type patient for existing. Now, patients can schedule online for recall and so forth. But what that did for us was we would wake up in the morning and we'd see little orange boxes all over the schedule. Now, we were able to accommodate that, of course. And I wish I could tell you that we had so many patients that we didn't know what to do with. In reality, there were a few when it trickled in, and then it started getting to be a really kind of exciting time where we'd wake up in the morning and look at our schedule and be like, there's 5 orange patients today. Broken tooth, new patients. Now, look at these statistics. 25 to 40% of new patients schedule appointments online. So there are things like Local Med, Addit, ZocDoc. I don't work for any of them, but I think it's important to be mindful that this was an area when I was managing a practice that I didn't even think about until we put it in, and we were able to now open a whole new avenue for patients to come into our practice. And keep in mind, I was worried that that was going to be an issue for my schedule, but we have a doctor all day long who can see a broken tooth and perhaps even just triage it, right? When patients are searching for a dentist, if you have the online scheduling ability, that is a huge win. And we can look at 50+%, right, of millennials and Gen Zs are booking online, and they're doing it after hours. So looking back at when my patients were scheduling, it was 11, 12, 1, 2 in the morning when these patients were actually scheduling onto our schedule. And so I think it's mindful to start thinking about ways to help us. And again, I like to always say, help us while we're sleeping. So I would encourage you to think about trying some of these online scheduling systems. Now, moving into, again, ways to help keep your schedules filled, we're going to walk through a basic day and also at the same time move through some of these additional companies that can help you. So online scheduling is one. Scheduling smart is two. With Pearl's Practice Intelligence, we have a color-coded opportunity schedule that will take your practice management system, look through all of the charts for you, and organize a opportunity-based schedule so that when everybody comes in the morning, they know every blue patient has something that needs to be discussed, right? Is there unscheduled treatment that they need to stop at the front desk for? Then they're blue. Is there unscheduled hygiene? Then there's going to be a button you click. We stop at the front desk. We'll highlight that schedule. That's done for you. Who needs x-rays? That's done. And also, who has undiagnosed dentistry on their last x-rays? So I want you to think about this being your virtual AI assistant. Again, I say while you're sleeping, because every time you put a patient on a schedule, you'll be able to have AI go to work, look through all those charts, audit those so that you have a color-coded opportunity schedule based on different pathologies, looking at who needs to be taken better care of today, right? There were times for me when we're just trying to survive the day working through a dental practice, right? Some days are so crazy. And patients would come to the front desk and they would be asking me, hey, Sheila, when do I schedule for that implant? When do I schedule for my implant crown? And they're at the front. We already had an entire appointment, right? So these color-coded schedules will keep those top of mind. You'll be able to think, Bob's coming in at 3 o'clock. Wow, he's blue. What does that mean? You also notice that this is a hygiene schedule. This is a doctor schedule, right? As far as cancellation protection, the first place I would always go is my live patients. Who's on hygiene that could fill my doctor schedule, right? The only thing we have guaranteed, guys, is the patients walking through that door. So why not have the opportunity that the entire practice is aware of all of these ways to help patients navigate through an easy appointment and save some time? One extra story I will share with you was when I was working as a hygienist, my doctor had gone to this webinar and it was all about same-day dentistry. And I'm a phobic patient. So same-day dentistry gives me so much anxiety because I have to have like, my blanket and my AirPods and my breakfast. And what I found was when I started asking my patients, well, Bob, looks like that broken tooth, I'm a hygienist. We've been watching, there's another chip off that. If we could get that done today, and I would say this very apprehensively, would you like to stay? And he'd be like, wait, I can get it done today? And I would look over and my doctor had an opening. I wouldn't even clean the teeth. We would just get the crown done, right? Because we can bring them back, put the crown on, and I could do the cleaning then. So yeah, I had an opening, which I could do other things, but we served that patient, right? And as we all know, when we serve our patients, our practice grows. So I do want to let you know too, there's other companies that you can work with that also focus on you hover over a specific spot and you can find patients that would fill that area. So that's really nice. I was always scared to send those text messages out because I thought, what if 10 of them want to come in, right? So I think I want you guys to think about ways to use schedules so that and other opportunities so that you can step away from that chair and step away from the front desk and work with your patients more, right? That building relationships is what's making your practice grow. So we talked about how the AI is actually reviewing your older images and pointing out areas that have not been moved to the treatment plan. So for example, this is a patient that came in, had her cleaning 6 months ago, and the AI has found an area of decay between 8 and 9, which was kind of surprising because this patient was very low caries rate. But we notice here, excuse me, that on the left side of this patient modal, this is one of the chart audits in Pearl, that there's no unscheduled dentistry. So we're pulling in all of the unscheduled dentistry, we're pulling all the x-rays. So because we see an area on the radiograph from the past, and we don't see a treatment code that would actually take care of this, so there's no outstanding filling that's unscheduled, then Pearl will tell you there's a prediction here. Now, keep in mind, AI is not here to diagnose. It is to provide additional areas for doctors to review. Here's one for the doctors so they can see the image without the AI. I wanted to make sure I showed that as well. But it's a really great way to have a schedule where, again, while you're sleeping, second set of eyes is going through your x-rays, looking at your treatment plans and saying, hey, there's an incipient lesion here. Take a closer look. Do you want to monitor it? Do you want to treat it? Hey, there's a periapical radiolucency. We don't see an endo code. Is this something you want to look at? Great way for everybody in the practice to have that virtual AI assistant to take the best care of their patient and ultimately have the practice enjoy the production. So we look at all of these patients throughout the day. Now, this is easy if you have 2 providers, but what if you have 22 providers, right? We're going to give your practice, this is my favorite, so office managers, this is for you, and hygienists, this is your provider roadmap for your day. What do I mean? I used to go to work as a hygienist early. Look at my schedule. Who's coming in today? What do they need? Who has the need for x-rays? Who has outstanding dentistry? Who has a miscoded prophy? Maybe I actually have somebody in my schedule who went from a, SRP to a 0110. And then ultimately for the doctors on the right side, all of those predicted findings that are on the old x-rays that don't have a treatment plan will be ready for your review in the morning or when each patient comes in. So we looked at that big schedule. We talked about other companies where you can hover over and focus on patients that can fill those holes. You have a blue patient indicator for every patient that needs to probably stop at the front desk. And then ultimately, whether you have a morning huddle or not, you have a patient-centered printout for each provider to deliver the best care, reminding them of what's scheduled today, what's remaining unscheduled in their treatment plan that you're going to revisit during their hygiene or restorative visit. Make sure they stop at the front desk if they need to. Doctors can review undiagnosed opportunities to see if they need to move those to the treatment plan or add more same-day dentistry. And front office teams, you don't have to worry about auditing your charts for who needs treatment, who needs x-rays, and also who needs periodontal probings. So this has been a game changer for offices to streamline their daily huddle or even their entire workflow throughout their day. There's great ways for you to be able to fill your schedules here. So what we were able to do very early on was we get a cancellation in the morning or we check the voicemail. I remember hoping that when I got to work, there was no, back in the day where the phones were beeping, I'm dating myself, but have a little light or something and I'd pick it up and it would be like, you have 14 voicemails. And I'm like, oh no. Now we have text messages and such. But that was my first thing in the morning as an office manager was to go through and think, okay, I need to figure out where my holes are in the schedule. How am I going to fill them? And what we started using was these daily roadmaps to very quickly review all the hygiene patients and all the doctor patients. Maybe there's an opening where we can extend a doctor appointment, or maybe there's a hygiene patient like we can see here, Lindsay, who has a bunch of fillings. Can she fill the doctor's schedule, right? It doesn't always help. Sometimes they don't want to stay, but you have your live patient, you have your roadmap, and you are more likely to fill those same day openings by looking at these appointments proactively. These are for every time a patient goes on your schedule. When we move into our full schedules, right? Okay, we've looked at everything, we have filled our holes, and we're going to go through our day. That's like 11:30, 12 o'clock, right? For most office managers. And now what we want to think about is that one moment where we want the patients to understand the dentistry that the doctors are recommending, right? How many times have you stood in front of a radiograph and asked yourself, I've been standing here for 3 minutes. The patient still isn't understanding this little gray area interproximally between these two white enamel lesions. How it's so easy for me to see. Now, I'm kidding. But also, I remember holding up pencils when I was talking about periodontal disease and where the bone level should be and where it is and how we needed to move into scaling and root planing or little tiny calculus spurs, especially on those new patients, right? And what we have seen is that not only is it interesting for me to hear that 87% of patients prefer to go to a dentist with the latest technology, but that using AI images with these color visuals, patient-friendly visuals, if we will, they are seeing a 30% increase in case acceptance. That's a huge win, right? If our patients could accept the dentistry when it was a tiny lesion instead of turning into the need for a crown or ultimately a root canal, then we're taking better care of our patients. Our patients aren't having post-op pain or confused or wondering, Why is it hurting all of a sudden? Well, we've been telling you for, the last 3 hygiene visits, and ultimately a more retained patient that stays in your practice and organically refers their family and friends. So think about using AI as a way to boost that overall office production by just turning on colors. The reason I came to Pearl is because I fell in love with the ability to have a patient see what I see. They're able to see calculus, they're able to see interproximal lesions, they're able to see where, we can see even on tooth number 30 here, is this big red cavity getting close to the nerve? And with more patients seeing these areas in a color-coded manner, they are going to be accepting the dentistry that the doctors are recommending and the hygienists more often. And assistants, you guys are the one too, if you're here, where the doctor walks out of the room and the patient's like, what did he or she say? And do I need to do that? What did they say? And I think that's really powerful to remind yourselves that not only are they going to understand and accept earlier and more often, but you are buying back more time to have that relationship with the patient. Stop talking to the x-ray and turn to the patient because they're more informed now. And we've bought back 2, 3 minutes in our case presentation, but we also bought back time to listen to the patient and hear what their concerns are and ask if they have additional questions. That is really helping us be mindful of the patients that we saw in the morning that were blue, them coming out, and we know that they're more informed, they can make better decisions, and the goal is every patient leaves with their next appointment. So I think one of the important things to be mindful of is how many patients are walking out of our day without their next visit, right? It's really important to maximize that live patient. When we started putting in next visit, which was our new implementation I got from one of my mentors about 10 years ago, we really saw our pre-appointment for hygiene rate go back up to about 92%, and our schedules were more filled because we were more mindful of, oh, did they get their next visit? And it was kind of this ongoing joke for about 90 days, but that was a huge turnover in revenue for our practice. It's so hard to be mindful of all the things the doctor and hygienist are doing in the back and then bring it up to the front. And as a hygienist, I would walk up and think, well, aren't you ready for my patient? Bob's here. I've been showing him these incredible images for the last 20 minutes. I took an intraoral photo. He needs a crown. And until I moved to the front desk, I had no idea that they are really focusing on about 900 other things. So when we started focusing on improving that handoff, that's really where we took our production to the next level. Now, I don't think this slide is shocking to anybody, but what I want to point out to you is 64% of patients say they don't understand their x-rays during the consultation with their dentist, right? And that's a way where we can immediately turn on AI, no change in workflow, no new machines, to be able to help our patients accept the dentistry earlier and more often. So this is how your case presentations are working with AI. And again, being able to think about ways where your patients see what you're seeing, accept that, hygienists, doctors, and assistants, you have a new way to explain this. Incipient lesions, like little pink ones you're going to keep an eye on, or the more progressed through the DEJ is going to turn a darker pink. I love these tooth parts. One doctor told me, the cartoon teeth are great, Sheila. They're very helpful for me. My patients are understanding which teeth we're going to wait on, which teeth we're going to fill, and I don't have to explain everything in black and white anymore. So that was really kind of a funny story, but important to be mindful that, again, AI is not here to replace a dentist or diagnose for you. You're not going to go able to, fly over to the Bahamas and be on vacation and the AI is diagnosing. That's not the case, right? AI is able to do simple things like find a cavity in shades of gray, and it's not perfect. But what we did find in our FDA trials was we looked at the dentist looking at radiographs alone. They were not perfect. We looked at Pearl looking at radiographs alone, finding cavities and pathologies. They were not perfect. But what we found is when the dentist looked at the AI, we were better together. And I think that's the moral of the story here from the AI side of things. So again, we talked a little bit about the treatment acceptance. This was really surprising. I was involved in focusing on this case study myself, and I was looking at x-rays back from little notable margins to recurrent decay to broken off crowns, right? And that's where I thought, oh my gosh, this is like terrible. Patients are losing teeth or losing crowns, fillings, whatever the case may be, because we're not catching all of the disease progression, whether we're too busy or, there is inconsistency in diagnosis. Now, again, it's important to step back and be mindful that AI is great, right? It's going to do numbers and find patterns and make recommendations for our schedules, our patients, answer phones, doing chatbots, but it's not going to do things that we need in dental practices, which is empathy, judgment calls, creative ways to focus on how to get patients on the schedule. And what I mean by that is when you're talking to that patient, that ultimate moment where they're making their decision, does the front office know, right? Did they have a great handoff? Did they know from the back to the front? I used to call it what, why, and where, right? So our hygiene team had to figure out what needs to be done in that appointment before the doctor arrived. Why does it need to be done? Dr. Penrod, there is an area of concern here that I see that the filling is actually broken off. Okay, we know what now, we know why. And where's this patient at? So Bob's interested in getting this done, but he doesn't have any symptoms. That's the handoff from the hygienist to the doctor, right? Now, we used to bring our treatment coordinator into the back, or we would use earpieces to make sure that information, that what, why, and where, got to the front desk earlier. So that way, the front desk now has time earlier in the appointment to understand number 13 needs a crown, has a broken existing filling. Bob's looking to schedule. Now I can go be successful as a coordinator, be ready for Bob to set up his next visit because I had earlier awareness. So we started doing our exams a little earlier. Now, what do we do once we need to think about filling tomorrow's schedule? Right? So we looked at AI enhanced schedules. We talked about companies where you're able to focus on, hovering over openings and finding ways to fill schedules. We all know we can go into our practice management systems and print lists. Well, we all know we don't have time for that. I probably could do a poll right now with a bunch of office managers here and let you guys know that unfortunately, those luxuries of the time we had doing recall and filling schedules, as the staff challenges continue, those are luxuries to sit down and make phone calls to patients, which is what we need to do to focus on our practice, has become a luxury. So we need to lean on technology. So for example, I used to print lists, crowns that are overdue and it would sit on the desk for a good couple days until I could get back to it, right? But using technology to know that in real time, I can pick up the phone. Well, let's take a step back. I can look at my schedule and I can say, whether you have one provider or three or five, you can say, Dr. Jones has an opening on Thursday at 4 for an hour. You can pull up a recently canceled list and you can very quickly know per provider, the type of treatment, the amount of time. And you know why I love this list? These are patients that fell off the doctor's schedule last week, and you can adjust the time. But I can fill schedules with real-time, simple approaches, knowing which provider, which type of treatment, and how much time it needs. I can use this and get through probably 10 patients in probably an hour. Now, I used to cheat, and I'm telling you how I cheated. For me to fill schedules, I'd first go to who's available today. Can I maximize my live patient? You use those morning huddles. Then I would go back and look at who fell off my schedule in the last week or so. And hopefully you have your reminder system set up to do that, or also that you have a way that you're tracking those. Unfortunately, we used to put little red squares on the bottom of our practice management system to remind us to call Bob back. And we never did anything about it because we didn't have time. And like I said earlier, with the printed schedules of all of these patients from my practice management system, I still had to go back in, see if they were scheduled, check everything again, make sure they didn't make an appointment. That step's been removed because in real time, if a patient schedules, then these patients will fall off your list. So again, I've already found ways to maximize same-day dentistry. Now I'm focusing on the rest of my week or even tomorrow by recovering patients that fell off my schedule. And the way I'm cheating, I hate to say that word, but is because they've already accepted. I just did a treatment plan. They agreed to it. And most likely in the last 30 days, that insurance is still active. Now, we all have unscheduled treatment lists that we go back 2 months, 3 months, 6 months. It's really an infinity amount of patients we could be calling. But can we give you lists that make your life easier so that you can quickly recover patients to move into filling those openings, right? Now, let's take a step back and think about why patients cancel. Couple things that I have learned through my world of consulting was number one, they didn't understand what they needed to do. They didn't understand what the appointment was. I thought I was coming for a cleaning. No, this is a crown appointment. Now that's on us sometimes, and that's on the patient. Number two, they didn't understand the actual financial responsibility sometimes, right? They'll call up and we call to confirm them, and they're like, okay, was my insurance covering that? And again, that could be on us, that could be on the patient. And number three, life happens, right? And our goal is every phone call is to recapture the patient back on the schedule and then make a list of the people that didn't. You don't have to do that list anymore because it's right here. To be able to say, hey, Bob, thank you for letting us know. Is there any way you could come in earlier or later today? And then if not, what is the next best day that works for you, for your schedule to make sure you can come in, right? Because I really want to say, what is the next time where you're not going to cancel on me again, right? But I can't say that. So it's important to be mindful of how they're canceling, how we're recapturing them, why are they no-showing, right? And people always ask me about no-shows. Do you, charge them $1 million? Do you actually not appoint them? And I feel like we need to be really mindful of not creating systems that are based on our outliers, right? When in my last practice, we had about 11,000 active patients, and this was a private practice. And our team was like, but you know what they do to our schedule? And I'm like, I know, but listen, you only have like 30 of those, right? In reality, that are the repeat offenders. So we would call them and say, Bob, I'm not sure this time's working best for you. What is the best time for you? And they would say, oh, like 3 to 5. I'm going to call you as soon as I get an opening the day before. Does that work? And that's kind of what we did was so that was a win for our no-shows. I think it's important to take a breath and understand that no office manager and no AI system will solve this problem 100% of the time. There is a lot of theories about being able to overbook patients, and that's a different webinar as well. But it is nice to know that you have features inside of different companies and inside of Pearl that has thought about these problems that office managers and teams and treatment coordinators are trying to solve throughout the day. And important to know too that live in real time with AI, you're going to get most accurate information. So this is the last schedule I would use, which was I need to find, crowns to fill Dr. Penrod, send, and it would provide an entire list. And it's up to date. It tells me the last hygiene because I can pull them in with hygiene. And is this new and shocking information? No. But is it simple and streamlined? Do I have my AI virtual assistant sitting there waiting for me to say, what list do you need, Sheila? How can I help you? And I think that's important to be mindful of when you're thinking about what companies you can use to help assist you in this ongoing problem, right? Can you color code a schedule? Can you have a provider printout? Can you have recently canceled at your fingertips? And these are the things that office managers have told Pearl that they struggle with most consistently. Now the patient leaves, right? They didn't do the next visit appointment, which happens. And I wish I could say that we all had a resolution to this, but recently planned treatment, which is the people that you just recommended dentistry on that did not schedule. I feel like we have a small window right there, right? And that small window is get a hold of those guys in the next 7 to 10 days. So we used to call them back. Are there any additional questions? They didn't answer most of the time. And then we would text them a few days later. So having a way to have all of these lists ready at your fingertips in one area streamlines your day, saves time, and gives your front office team the gift of knowing they have multiple ways to now fill the schedule. Let's jump into an important topic, which is revenue cycle management. And what we mean by that is really that entire patient visit from the front all the way through the practice and ultimately into claims, billing, processing, collections, right? Again, another wonderful webinar we have coming up with Pearl is going to be with some of our insurance gurus who can assist with a lot of solutions. But look at these staggering statistics. 73% of practice managers struggle with insurance-related complexities. Now, that doesn't mean that the office managers don't know the concerns. They're struggling because the insurance is being, how do I say this, insurancy. So what I mean by that is, it's challenging with insurance companies. And I think with AI and the movement here is we're going to get some more clarity pretty soon, in focusing on the future where we'll have real-time claim adjudication, where we'll know in the chair how much the insurance company is actually going to pay. And you'll be able to confidently tell this patient that they're going to cover $70 or $700 of this procedure, and we submit the claim and we actually get paid the same day. Now, that is coming soon, doesn't exist right now, but that really kind of provides a lot more trust for a patient, right? They don't have to shop around because they know that we're going to give them the ultimate answer. But 35% of practices say that, focusing on insurance stuff is very time consuming. And on average, I remember focusing on how long it took to verify patients. And it was a full-time position in our practice, just verifying and checking outstanding balances, making sure that the ledger is correct, and that when the live patient comes, we're prepared to give them a reason for those additional collections. They check out at the front desk and they just want their toothbrush. They had a great cleaning. They're so happy as there's no cavities. And we're like, bring Bob to Sheila, and I have to say, hey, Bob, so looks like after your insurance last time, you still have a balance. And they're always shocked, right? Like, what? I'm like, well, we sent you 3 emails. No, I'm kidding. But I think we can all identify with that concern, right? And this time-consuming insurance process is taking up a lot of personal time for your front desk teams to be focusing on these relationships. Your front desk teams want to focus on getting the treatment scheduled and helping the patient finance, giving them that most important, crucial part, which is the insurance estimation when it's necessary, right? So only 39% of office managers polled said that they were going to focus on streamlining this. And I think the reason that that number is actually so low is because we don't know, I didn't know at the time, that there's other resources. So I do want to kind of walk you through one more way to save some time. We're going to jump into a little bit about what in the world is AI and how is it really helping us behind the scenes, and then open up for questions. But just like we talked about AI not being perfect, right? Doctors are going to see AI and they're going to say, that's not a cavity or that's possibly cervical burnout. But I'm going to take a closer look when I get inside. There is also some small inconsistencies with insurance, meaning like, okay, well, this says it's not verified, but it was actually terminated, right? And what you're going to feel is that your time with an automated insurance verification company is going to be cut in half. So let me tell you why Pearl's PreCheck has been extremely valuable for helping patients schedule their dentistry today. For example, we have a patient coming in, they're in hygiene. We want to do same day Invisalign, or we want to do a same day crown. And what we notice is we need to stop, check the insurance. Do we have any remaining benefits? Can we do that today? And a lot of times, guys, that's where the little sand timer, I want to like flip it over because the patients only have so much time and the doctor and the assistant only have so much time. So as the front desk team, we have to be able to kind of really expedite that treatment plan, right? It's like the Super Bowl of treatment plans. You have to get it right, get it now, and stop everything you're doing and make sure we can deliver it to the patient, hopefully while they're in the chair. And then we can just get them numb and get the crown going or bring the scanner in. And that's how our practice would add about $6,000 to $12,000 a day of same day dentistry because we were mindful of the opportunities early in the appointment. And we were able to very quickly look into what is that one obstacle? It's going to be finances. We have the chair, we have the time. Do we have the financial arrangement? And I think knowing that you have a company that can review all of your patients over the next 10 days, verify the insurance. Now, simplify this in a screen where all your providers can understand it. Doctor in room 3 is doing a filling. He notices the tooth behind it also needs a filling. It wasn't scheduled. Can look up and see that there are remaining benefits. Probably you want to confirm one more time, but you now have visibility. Same story would be you have hygienists. Can I do fluoride? Can I take x-rays? Right? And those are important things that we need to know because those are moments of quick decisions where if we don't get the green light, we got to move on, right? So $30 of fluoride times X amount of patients or radiographs. Hopefully we're doing these things complementary as needed, but at the same time, you now have less time you're focusing on verifying insurance. You also have more time to talk to your patients. Now, by using Pearl's PreCheck, we're able to help you understand that you're going to get more patients verified more often. When I was working with the team on PreCheck, we were looking at additional competitors. And what I found was there were too many clicks in different other companies, right? It was important for us to know that these areas that you office managers are focusing on a daily basis are already streamlined and summarized. So that patient sitting in my hygiene chair that wanted to do a night guard would take a little while. Not only would it take a while to get that to the information to the front desk, but it would take a while to go in and say, okay, how am I going to get that treatment plan? I go into Delta Dental, click, I think it was 16 clicks to find the night guard code, check the percentage, and get the dollar amount, right? In Pearl, it's already done in the summary on the upper left-hand side. So we polled office managers and we said, what are the top 10 things you're looking for? Let us get that information from the websites and put it in a summary. So think about this, coordination of benefits. You're focusing also on downgrades, deductibles, and those are the things that are a big problem for same-day dentistry and focusing on how do we get the patient to accept the dentistry before they leave for the day. So, what percentage of patients understand dental insurance? Does anybody know? Anybody want to jump into that chat? I know we're moving into the last 10 minutes here, but let's see what the guess is. I love that answer. 0%, right? A lot of times we think that we have to give them so much information for them to understand the treatment plan the doctors are recommending. So the answer is very similar to the x-rays, I was surprised to see, but 65% of patients are confused by dental benefits. And we all know this because they're like, wait, what? I thought my insurance covered 100%. And that's not the reality. So we need to be mindful of our last point here. Treatment presentations, the old way versus the new way. And I'm just giving you this little tip because scripting is everything for some practices, but we just need to get behind the eyes of the patient. So the old way, and again, sometimes this happens when I was consulting and watching different practices present treatment as a coordinator and sometimes a hygienist or a dentist, we feel like the more information we give you, the more likely you are to accept what we're recommending, whether it's a scaling and root planing or a crown or a filling, or even if it's the treatment that you're recommending, right? So I know you guys do not do this, but sometimes I still hear teams saying things like, after your PPO maximum of $1,500 minus your $75 deductible with 80% basic coverage, insurance downgrading on the posterior teeth, looks like they may pay $400 towards your PFM. Your portion is $800, which may change if we need to do a buildup. So we see our preps at 8 and 1. Which day is best for you, right? We may as well be speaking a different language. So I would encourage you to simplify all of that wonderful information you have in your mind that you're going to need. I am not saying don't verify, don't know the breakdowns, and don't know the percentages or if they're downgrading or not. But our patients do not need to know all of that information. You're going to tell me that you have patients that say all of those things, and I believe you because those are the outliers. But I would encourage you to try this because we moved into we called one number treatment plans. Mr. Jones, after your estimated insurance coverage, your portion is $800 to fix that tooth. What days work best for you? Mr. Jones might say, well, wait a minute. And you're going to have all of that information you've already gathered, right, to answer those questions. But I would love to hear from you. I'm going to put my email at the end of this webinar here and let me know how that worked because that was a game changer. In fact, it was very challenging for our front office teams to focus on that new way. So I hope today you have seen some ways to start focusing on, the buzzword, which is AI. But really what that means is there are tools out there to help streamline some of those very mundane tasks that you're working on. This is what most people think AI is. It's coming to take our job. It's the Terminator. In reality, it's already working in our world, doing basic, simple problem-solving things that we've taught it to do, right? We taught it to look at an X-ray and circle a cavity. We've taught it to talk back to patients. There's a lot of ways to streamline your day so that you can start spending more time with your patients. There's different versions of AI, and guess what? Everyone on this call is already using one of them, if not more. Whether you're using facial recognition, which is computer vision, a form of AI, and machine learning, to open your phone, whether you're using it at the airport. We all are familiar with Siri and Alexa and ChatGPT, but also, I jumped in the car yesterday to get my son from the airport and I put on the navigation. I know how to get to the airport, but I want to know if I'm going the best way, the fastest way, and I don't want to think about it, right? So sometimes these mundane tasks can be solved. As we move into predictive analytics, we'll be focusing on more important things like, will this E1 lesion move into, through that DEJ in the next 6 to 12 months and how fast and how is the bone level doing? It's important to keep this vision in mind that really you are the writer and the driver of the AI, right? It's not just taking off and you're following behind, hoping to stay on the horse, but you are in charge. So I want you to take comfort in that. And also remember that we can be more efficient. We can have more availability, like when we're sleeping. And we can buy back more time to have more personalized appointments and more treatment plans and more relationship building time with our patients. So I hope you guys have seen how you can use AI to help fill your schedules. We talked about the ability to use online scheduling, resources for focusing on filling holes, also making sure that you have a great cancellation plan that's proactive. If you found this interesting today, we would love for you to scan this QR code, schedule a quick demo. This is our second opinion feature that focuses on that instant AI radiograph analysis where you take an X-ray and you'll be able to see these images in real time. And the other feature that I just discussed with you today with all of these scheduling things was our practice intelligence and our ultimate pre-check. So we want to make sure that your patient is taken care of from the beginning of the appointment to the end of the appointment, that they leave happy and they leave with their next visit.